Mission statement, Rosemary?
Our mission is to support the goal and values of the Soledad Community Health Care District.
Okay. President's welcome. Approved minutes. Is there any additions, corrections, or addition to the minutes as mailed?
I move the minutes be approved as mailed.
Do we have a second? Okay. Roll call vote, please.
Graig?
Yes?
Maggie?
Yes.
Rosemary?
Yes.
And Adam.
Okay. Public comment. Members of the public are welcome to participate in the meeting of the board. When the board president recognizes a member of the public for all comments, such comments will be limited to 3 minutes or less at the discretion of the board president. Comments from the public will be accepted during the public portion of the agenda only. No action will be taken by the board on matters not on the agenda. Any public comment? Go ahead.
Well, so I'm Elizabeth Romelli, most of you know me, but, okay, sorry about that. So I just wanted, again, to say that I'm a little concerned about being understaffed here, about a lot of people leaving, even people that haven't been here that long. And with the travel nurses, I'm not saying that they're not good, the agency nurses or whatever, but I truly don't believe that it's working out here. You know, they don't know what's going on. They don't get enough instructions maybe to what they have to do in the morning, and that's a bit concerning for us as a family, but concerning for the residents themselves, you know. You need to have harmony, okay? Things need to move a little smoother, okay? And here everything is, it's one big agitation, okay? People get upset. And it's not only my mom, it's other people too. So really have to try to find a solution about getting more staff, but staff that remains. That's the only way it's going to work out. That's all I
Thank you.
have to say.
Anyone else?
Yes,
ma'am.
I'd like to speak, and I actually have more than enough to say that will take more than 3 minutes. And you know how to find me. You know I'm Romelli. Well, there's COVID here, and I'm sorry, I'm going to scream as much as I can, but there is active COVID on this unit, and I've been in my mom's room, and so I feel that it's my duty to protect you as well as protect myself. And so I'm going to leave my N95 on.
You know, I'm having a hard time understanding you.
Well, do you want me to get closer?
No, I can hear you. I can hear you, I just can't
Okay,
understand
then
you.
I will try to shout. And I'm not going to take my mask off.
It's not the volume, it's the voicing of the words, because the mask.
Okay.
It's hard.
It's hard? Okay. Well then, how about this? You know how to find me?
We know what?
How to find me. It's called 678-3213. Because I have more than 3 minutes of things to say about Eden Valley that I would like to share with you folks. And there's so much that 3 minutes will not cover it. But what I can tell you is there is a reputation that Eden Valley is not where you go to get good medical care. It is, yes, Ida, a beautiful facility and a nice facility, but that's not what's making Eden Valley what it needs to be anymore. We have a family friend who was here who just left. She left because of non-attention to medical issues. She ended up in the hospital. She is not coming back because that family refuses to come back to Eden Valley right now. Perhaps in the future, but not now. We also know there was an exposure to COVID because a resident was brought to the activity room knowing she had a cough, but she was tested after and got exposed to all the residents, including my mom. There are so many little things that happen here every day with my mother that we have to call every day to make sure she's okay. And you know what one of the major issues are? She has cancer in her leg, and they don't even know when to do her wound changes. Unless we call, those wound changes are not getting done on a regular basis. So you can have the most beautiful facility in the valley, which it is, but when you don't have good, consistent medical care, it is a scary place to be. And my mother is scared right now. She is absolutely scared, and we are scared for her. I had to come down here this morning and spend all morning with her because she was so afraid, because she didn't feel well. And she doesn't trust this place. I know I'm beyond my 3 minutes, but you know, if you care about the residents, you're gonna listen. Because see, I've been through this with you before. When my dad had COVID, no one saw him. I called you. I asked you, I said, you've got bad medical care, and you wrote me off. My dad died here, so you're not going to write me off anymore, Graig. You're not. You need to pay attention to Eden Valley, and you need to call me, or you need to have Ida follow up with us, because it's not happening.
Okay, 3 minutes are up. Thank you. Anyone else on public comment? Okay, close public comment. Oh, someone?
I'd like to say something. My name's Wes White. Videographer at large, documentarian. I've been coming to the last couple of meetings, just asking for transparency. I noticed you still got Zoom. Last time it was Zoom. It's very easy to record and publish on Zoom. I'll go away just as long as it's up. I got 120 views just by putting it on a Greenfield and Soledad community Facebook pages. So there is a lot of interest, and it does sound like, the public feels like they need more interaction and coordination. So, it'd be real easy. Just go ahead and put it on Zoom, record it, publish it. And, that's the only reason I'm really here. But I'm also here to support any community members who feel like they have grievances with any public entity, which is why I do this on a regular basis. So I'll be here until it's on Zoom and available to the public, because board meetings, any public entities, they should be available to the public.
Thank you. Anyone else?
She wants to speak, but we need an interpreter. She wants to speak.
We don't have an interpreter.
Speak, but he needs an interpreter.
You interpret
for her.
You interpret for me.
Okay, dicen que todo lo que estoy. Ajá, sí.
Que ahorita en la clínica cuando estamos llamando para que den una cita, no nos contestan hasta 2-3 días, y ya después dicen, porque yo llamé para hacer una cita para mi hijo y me dijeron que no había, que con la doctora que yo quería no se podía, que porque esa doctora ella ya no quería, que tanto doctor que había, que porque
So she's saying, when she calls the clinic, she says that the answering is bad. They'll call her back 3 days, and then they finally answer. They're telling her, oh, the doctor's not available, and there's no availability for her son, and she needs availability because she's calling for a reason.
Y que mi sobrina le pusieron cita para venir a una cita y no la quisieron atender, tenía el niño mal, le dijeron que aquí no es hospital, que se fuera al hospital, y no lo quisieron atender, y vino 2 veces.
And she said that she makes an appointment, her niece made an appointment, and they gave her an appointment, and then she came, and the child was sick, and they told her it was not a hospital, they need to go to a hospital. It's a clinic, not a hospital. And that's what she wanted to get for. Thank you.
Thank you. Anyone else? If not, we'll close public comment. Communication coordinator.
Yeah, so I do have a few updates for you all regarding our quilt fundraiser. We do have a letter that was drafted and approved by our foundation board. We're going to be raffling off 3 items. One of them will be an Amish quilt. The second item is going to be the Holly Casey quilt. And then the third item is photography by Joanne. And that's going to be a framed canvas. So there will be the opportunity to win 3 of those items. You'll see that I provided you with a sample of what our raffle tickets are going to look like, because we're doing it a bit differently this year. They'll be having the option to look over our letter. Also, they have the option to scan the QR code and purchase tickets online. And then this is what we believe is going to be our more favorable option, which is filling out the information and then sending the raffle tickets back with us, along with their payment. As far as outreach goes, we do have a lot of community impact that we're providing to Soledad. So I spoke for an 8th grade presentation at Main Street Middle School for a history teacher named Mr. Ortiz. I went over each position that you can work at either Eden Valley Care Center, the clinic, or the Women's Health Center. And the students were very pleased with all the opportunities that you can have working in your own hometown. There was also a college and career fair day at the high school that our HR manager Charisma and our payroll assistant Yvonne were a part of. So I want to make sure that I supply them with enough marketing material, like cups and coffee mugs, pens that have our logo on them, and all of that. So as far as outreach goes, that's where we're standing. And my biggest thing that's keeping me busy right now is the quilt fundraiser.
Any questions of Jamie?
And when's that?
That's going
Mother's Day.
Yes, for Mother's Day.
And when are you gonna mail out the tickets?
This upcoming week.
Okay.
So we'll have the printed tickets ready on Wednesday, I believe.
You have
Because
the
now
quilt
we're
already?
getting numbered. I'm
You
sorry?
have the quilt yet?
Yes.
Oh, we got them.
Yeah.
I haven't picked up Holly's yet. I have the Amish quilt already, and I just need to go pick up Holly, so. But I've seen pictures of her quilt, and it's just beautiful.
Thank you for the donation.
Yeah, you're welcome.
Thank you, Jamie.
Thank you, Jamie.
Okay, code of conduct. Does anyone have any additions, corrections, or additions or comments about the code of conduct?
I didn't read it. I'd like to make a motion that we stay this over to the next meeting so we can finish reviewing it and looking at references. It's something needs addressed, but I think we need to go through that.
Okay. So that's a motion? and we
I move to
Table it for next meeting.
the discussion to next meeting.
Second. Anyone have a second?
I'll second it.
Okay, all in favor? Well, roll call.
Greg,
Yes.
Maggie,
Yes.
Rosemary,
Yes.
Ann,
No.
and Max.
Yes.
Treasurer's report.
Okay, so I'm gonna take this off if you don't mind,
Thank you.
just so you can hear me, explain the numbers. So starting on page 13. Okay, what we have, you'll notice our cash, we have 1.3 million. It's a drop of almost $1 million from the prior year. The good news is that our receivables are up due to an increase in our census here at Eden Valley. You'll notice that our accounts payable is up a little bit. We're holding on to our payables just a little bit longer due to the cash flow. Once the revenue starts rolling in from the increased census at Eden Valley, that should go back down. But you get the people in the beds, and it takes about a month before the money starts rolling in. So that's one of the reasons for the payables being a little bit higher. You'll notice that our bottom line, which will be explained on page 14, is like the fourth line up from the bottom. Here on page 13 is a negative 965 for the 7 months. For the 6 months. No, 7 months. This is January. Trying to remember what month we're on. This is January 31st, so this is for a period of 7 months. Okay?
Yeah.
So let's turn to the operations. You'll notice that if you look at just the operating revenue, if you look at the operating income, loss before depreciation, we're at a loss of $908,000 for the first 7 months, compared to a profit of $44,000 the prior year. $952,000 drop. And you'll notice that our expenses are down $138,000, but the real drop is in our revenues. And we have $1.2 million decrease in medical service revenues. Because of census here at Eden Valley. For the first 6 months, it's picked up. It's picked up recently, which has been great. And you'll see that further down. You'll see that Eden Valley actually made a little profit in the month of January, the first time in almost 12 months. But also, you'll also notice further down in a few pages that the clinic has also, number of visits and the billing is not where it has been in years past.
And so that's reflected on the,
It's reflected in the
And that
medical
1.2.
service revenues,
what
yeah.
about, money coming in? Is it slow to come in? You know, is there money on the books that hasn't showed up for January that might see in February?
It's usually about depending on the insurance company that we're dealing with, it's usually about a 30 to 45 day lag
Okay,
from the time of payment. So there is a delay, it's not immediate.
okay. I was
And that-
hoping that's what it was.
And there are certain times of the year where it's even later than 30 to 45, it's more like
Yeah.
45 to 60.
That's what I was hoping that was you were gonna tell us.
Another question, I think I sent it up to Greg, I was doing some research and I noticed, I do know that when you shift your billing and your medical records, that can be a good thing, but also because there's differences in those practices, you may not be as efficient as you were, and if you don't catch that, that could add some negatives. And the resolution that I found from talking to a couple of CPAs and looking online is that we go back and audit our patient count, our visits and our billing before the change and after the change and look for trends. It's not that we did something bad, but when we make that change and we stop using outside billers and now we're billing it inside and making all those shifts, we may not be as efficient as we used to be. And part of it could be that we're not billing efficiently, possibly. And that might be an area where we're finding a loss because of those errors or mistakes. And that's just something to look at. It's not a pointing the finger, it's saying that's a thing to audit that might be part of our problem because we're not finding a problem and we're cutting hours and we're still going down, so maybe it's something in the billing system that we're not doing as efficiently or different than it used to be.
So that's a common generalization, but that's not the fact of what's happening.
We don't know that because we haven't looked at that.
So I've looked at it and I've worked with the Athena group. We've actually generated more than we even estimated at the time when the service was put in back in 2021.
Is there a report for the board to look at that talks about that, or just
so
you dealt with that?
I dealt with them myself, so it's what is presented there right now. Those revenues are due to what Craig has mentioned, Brent has mentioned to you is more in relationship to that than the other.
Okay, go on.
Okay. So, the bottom line, the net increase is a negative 965 as compared to a positive 142 the year before. And then down at the bottom, you can see it by operation. The Eden Valley for the 7 months is showing a loss of 233. The clinic is showing a loss of 358, 359. And then the district-wide expenditures is showing a loss of 373. Okay. The next page, page 15, basically gives you a breakdown of your cash and receivables between the different accounts that we have, as well as the receivable balance. You'll notice the Eden Valley, the receivable balance is $890,000 in comparison to $471 the year before. That's because census is up, so that is good. You'll notice summary of income by month. January, we showed a loss of $133,000, and that was primarily from the clinic, but we'll see that in the clinic and administration. And then down at the bottom of the page, once again, the gross revenues by type. If you follow that column all the way over to the right, you'll see the Medicare is 27.5%, and it needs to be around 50, but this is the first month that I think it's been over 22, so it's on the rise, and so that's
What did you
good.
say it should be?
50,
50.
yeah,
That's only 2 weeks.
yeah.
It's only representative of 2 weeks in the month of January.
Oh.
The census being up, so we're hoping that February will be the
Oh,
real
right.
full month of having the
So when you break down
events full.
the business units by themselves, so if you look at Eden Valley itself, it actually generated a net of 17,000 after expenses. So their net year to date is actually on a trend of reduction. When you look at the Soledad Medical Clinic, their net was minus 56,000, and their net income actually increased by a negative 358. So we'd still have the Eden Valley going in the right direction. The clinic is still the space that we need to look at a little bit more.
And that includes the clinic and the women's health center put
Combined.
together for that 56.
Right, all clinical outpatient services is one unit. And Eden Valley is a separate business. It's a skilled nursing facility.
I understand that.
That's a
Sometimes we
difference.
list the clinic separately, sometimes we don't. That's why I was making sure that it was included.
Yeah, it's always included together. Mhm.
Okay, so then we have on page 16, you have Eden Valley. Once again, I did the expenditures on this by department, and then below I did it by expenditure type.
And this is for 7 months,
7 months.
and the census went up.
The end of January,
The end of
2 weeks, 2 weeks of January.
Middle of January, right?
Okay.
So you look at your revenues, and we're down $1,000,001. 600,000 of that is in Medicare. And then other income, 551,000, it's down 551,000. And that is in the year before we received some substantial COVID money, which we have not, we're not entitled to at this point, so.
And remember, we're in an inflationary year, so we're also experiencing high cost of doing business, which includes high cost of supplies that come along with that. So those additional expenses has also gone up, including the price for staffing has also gone up.
Okay, under expenses, what's this professional fees?
Those are, that would be your accounting, your legal, your,
Okay, I want to ask about the legal.
yeah, I don't know, I don't have a number right here, I can take a look.
I can share that. So
Uh-huh.
we just got recently a bill of close to $11,000 for legal services.
Okay,
Where?
legal fees.
Legal fees that we've dealt with. So it's dealt with a lot of correspondence of, with Mr. Shell. It's dealt with dealing with a PRA, which was a public records request that we got from Andrew Sandoval that we've been dealing with since last year. And it's added up. It's added up.
Mr. Shell, are you still emailing the lawyer?
I sometimes send messages to Graig and the lawyer to get some clarification on things that the lawyer should be looking at.
That he should be looking at?
Yes,
And who determines that?
I need to get clarification, and that's my responsibility and my right.
Well, you can call our CEO.
I don't get the same answer. I'm looking for information from the legal perspective. And actually, I don't get much good information there because she tells me I used the wrong instructions, even though the instruction says the same thing.
Well, please remember that it's costing us money every time you do it.
We're
And we need money for other things.
losing money in general, and that's why I'm trying to research things.
Well, you're causing more money instead.
I didn't cost $300,000 of professional fees. And I didn't cost $11,000.
If you'd like a breakdown of that, I can provide a breakdown.
I would love a breakdown of all the sub-accounts. I asked for that last month, and I was told that was too hard to get. If we can't analyze some of these, how do we say, oh my gosh, that's much higher and lower? Because they're all lumped together, and we don't know what this is, just like she's asking, what are professional fees? Well, that's several categories. And having that sub-account, oh, professional fees, where legal fees are here, and whether it's providers at Natividad or however that comes out, that's good information to compare to. And to compare to the budget amounts that we don't have, that would be very helpful to analyze, other than just say, hey, those look like nice numbers. We don't have that information.
Well, and I think the other thing that Rosemary was looking at, when you look at the variance of professional fees, is 19,000. If we didn't have the additional 11,000, it would almost keep us in line with what we had spent the year before.
Actually, we're
it's
down.
lower than last
It's
year. It's actually $19,000 less this year, including that 11,000.
Oh, okay.
It's like a,
Yeah, it's down here.
okay, you got it?
I think
It
it's
was
just,
hanging from
it's
your
just,
chin, I'm sorry.
it's just a.
No, thank you.
You did.
No, that's thank you. I didn't feel it, that's what I was doing. Thank you.
Okay, so going on to page 17. This is the clinic and women's health center combined. You'll notice that our gross revenues are down 839,000, but our contractual adjustments are also down 919. So we're actually 110,000 more in net revenues this year than the prior year. But once again, here the main cause of this is you'll look at the depreciation is higher because we have a full year of the women's health center being depreciated. The other differences are the professional fees. We have a offsetting decrease in doctors, but it was the offset was the professional fees for the nurses and doctors on the, what is that called? Also travel.
Yeah.
Okay, agency.
We're
Okay,
not using travel.
but those stopped in
January.
January.
So you're still seeing those numbers right now because those stopped in January.
So the traveling nurses have been eliminated or
Yeah,
those
so,
positions have been filled?
So after Dr. Jackson left, we had to put in a replacement, and we did have Dr. Gamboa, but it took us till about October, so we had to pay for that change. And then shortly after that, we had Dr. Spencer, so we wanted to supply that, and so they did. The decision back then was that they did. But once those agreements ended, we just ended them altogether. Yeah,
So those fees should significantly drop, right?
absolutely, yeah.
Okay.
Because they're pretty expensive. They can be anywhere from $30,000 to $40,000 a month. Yeah.
And that also includes the Natividad doctors because they're in a contracted category there too.
Well, yeah, they're providing us a service.
Yes.
Okay. And then down at the bottom, this is where you'll see January. You'll see Eden Valley made a profit of $23,000 for the month of January.
Wow.
The clinic lost $20,000. You know, and if you look at that combined, you're saying, oh, it's a net profit of $3,000. But once again, our administration expenses are $93,000. So really, we're still $90,000 from breaking even.
Yeah.
So,
We have a ways to go.
you know, we have a ways to go, yes.
And all the capital expenses of the women's center are lumped into that 19,000 loss, correct?
The capital expenses as far as,
We're paying, the debt load that we're paying.
the interest is, the depreciation of the building is not, the depreciation is listed below that.
So I'm saying the fact we're still paying for the women's center is covered in that minus 19?
Yes,
Okay.
yes. Okay?
So can you clarify your question?
I'm talking,
Max,
we're,
what do you mean paying for the women? We're not paying for the women's
well,
center.
we lumped all of our capital improvements into our operating expenses, and so now we're paying off that improvement by adding the building instead of keeping that a separate budget item and figure out how we finance that. And so the capital improvements are not broken out in these finance reports, just
Well, there are no capital improvements
There is
for
none.
this fiscal year. Those were all in prior fiscal years.
okay. Well,
So the only capital improvement cost that you have here is the debt load, which is the interest, and the interest is included in that.
that's what I'm getting at.
Okay, so,
It's still part of the capital because we borrow the money to spend it, so it's paid, and now we're paying off that capital because we're paying off
We
that
didn't
loan.
borrow money. We didn't borrow money for that.
Well,
That was paid through the district.
okay.
So there is no,
If we had to borrow $4 million to pay bills because we spent money on stuff and now we had to pay off because we didn't have any money left because we paid for it. So the capital was mixed in there, it just wasn't broken out.
yeah, but it wasn't for capital. Just so that we're clear on the numbers, it wasn't for capital.
Okay. Building the women's center is a capital improvement.
Which was paid for by the district.
Okay.
okay. So then on page 18 is your summary of cash flows. This just tells you, you know, our cash has decreased by $1.9 million, and it outlines where the money went. So we had a net loss in operations of $965,000. The other big item there is the payment of the third-party settlement of $971,000.
So I think that's what you're trying to get to, Max. It's the third-party settlements is where it went to. And the third-party settlements is what is being financed. So
Okay.
just to be clear, there's nothing with capital. Capital was done through a foundation grant giving program.
How much money did the foundation grant giving pay for that women? How much did the Women's Center cost?
The Women's Center cost $5 million.
Okay.
And the
And-
remainder of it was paid through district funds,
The remainder of, so $3 million of it?
was paid through district funds.
Okay, and where do the
Yes.
district funds, they come out of the whole operating expenses, is where those district funds came
But
from.
that was prior to the lending. So just so you're clear, it's,
It was prior to the lending, but we spent the money, so now we didn't have any money, so we had to borrow money. Whereas if we would have lined that capital out and borrowed, we may not be in an operating deficit,
correct.
and so that's just
But the
breaking
money
it.
that we generated wasn't, the money that we borrowed is not for the capital improvements, just to be clear, because that's been completed. It's for now this third-party settlements.
Okay.
That's what it's being utilized for and earmarked for.
And those decisions were made by a prior administration.
Yeah. Those were
It's
your.
still fact, I'm not.
I'm not-
We're just trying to give you
Disputing
some
that.
context to the background of your question.
Can I ask a question, Brett?
Uh-huh.
I know there were problems updating the budget. Have those been resolved so that we can get that?
Yes, so we met this a week and a half ago, 2 weeks ago, and we have gone through the budget, and I'm working on it we noticed a lot of discrepancies in the budget that weren't tied to actual numbers or weren't tied to realistic numbers. And so we are updating that, and it's taking a little bit of time, but we're almost there. And I'm updating it for this fiscal year, but I'm more looking at it as a planning tool to use for next year, because we're already 7-8 months into this fiscal year. And devising a budget at this point isn't gonna change a lot for this fiscal year, but if we can devise it so that we can finish this year, but mainly looking forward to next year, then we'll have an actual tool that we can use moving forward.
Yeah, that was where that question was going. So maybe when, I don't know if that would be an appropriate time for the strategic plan to look at that and look at budget.
Yes.
Okay,
The point is, that even the health and safety code by law says by September 1st, we have a public meeting to present our budget to the public, and we don't have a budget for ourselves available to the public, and that's 6 months ago. That's the question. And the law says that by September 1st, we present a budget. And so comparing finance reports without having a plan, what do you compare to? These are just, oh, how was it last year? It's good to look at, but it doesn't have a reference point.
that's why we got into the process of trying to actually build a budget, because there wasn't a budget prior to. Okay, so that's, you got a time for next month or a couple of months, how long do you think it's gonna take to get that squared away, just a ballpark guess?
A couple of weeks,
Okay.
and I should have that completed.
Okay, then maybe we can then move forward on the strategic planning session.
When is that scheduled?
We're now earmarking it for maybe March. We'll let you know. We'll send you guys that information.
Okay. Any questions of Brent? Thank you, sir.
Motion.
Oh, motion to accept the financial report.
I'll make a motion.
I'll second it.
Okay. We can't do public comments over right now.
Yeah.
On every agenda item, the public can talk about every agenda item, especially if it's an action
Let's
item.
hear it.
Oh. I just had a question, so I know census is critically important to finances. I would just like this board to understand how to balance finances and revenue and census, which is important, because it drives revenue against medical care. Because this staff, you've got good people out there, very nice people, but they can't keep up with the medical needs of the residents. So as you keep filling beds, you gotta look at the bigger picture of medical care. And there are some very nice staff people out there, they're doing their best. And I want to remind you, The other question I did have on the budget, because I wanted to understand it, is the best I can get was the, what was kind of given to me, I guess, legally. And I just want to understand something, because I looked at December 22nd, year end, and it looked like there was a cash of 1.5, but only investment revenue of $400. And yet this is all invested. So how can you only have $400 of revenue on that kind of investment, on that kind of cash?
Because there is no generated income right now with the low savings account values. So
That's so low that it's that low?
Yeah.
I mean, that's less than 2%. You can
Oh,
at least get 2%.
now the tables are
This is
turning.
December 22nd.
Yes.
December 22.
And we have to keep it liquid, so that's the other reason. So you have to keep it liquid, and you have to keep it available, but those savings accounts are not being paid at a higher rate as you're mentioning. That would require us to fix the dollars in a longer term, which we need to keep this liquid.
You need to keep that much liquid, because it's just not enough days. It won't cover enough days if there's an emergency here.
Yeah, we need to keep it liquid for operations.
Correct. Thank you.
Thank you. Okay, I have a motion on the floor and a second.
Greg,
Yes.
Maggie,
Yes.
Rosemary,
Yes.
and Max.
No.
Okay. Resolution 2023-01, authorizing the Soledad Community Healthcare District to incur indebtedness and to execute documents in connections with the revolving line of credit from First Capital Bank. Item.
Okay. So this is just a renewal of our line of credit that we have with First Capital Bank. And so this is a resolution so that we can continue that relationship and that renewal. So the bank is seeking that the board create this resolution and get it approved so that we can move forward with the line of credit of $250,000.
Any questions about it?
What was the interest on that line of credit?
It's gone up, so it's prime plus the spread, so prime 725, so we're probably now in the 8s.
8?
Yeah, yeah. It used to
Is that
be,
locked in for the year then?
no, these are variable, these are variable, so there's no fixed. Yeah,
And then
it's use as you go.
Oh, and it,
The actual rate is 8.75.
sorry, don't say.
8.75.
8.7. And then, does it, if you use the money, then
You pay,
then you get the interest, but if you don't use the money,
then
then
you don't pay.
we don't pay.
Yeah,
But right now, the balance, last I looked, it was about 250,000. So we already owe $250,000, so there's nothing to take out right now, we just have to keep paying on it.
Oh, we've used the line of credit.
yeah, you pay interest.
Thank you.
And so this is a resolution to keep that line of credit after, by paying it off and not having a line of credit. If we didn't do this, then they'd say, where's $250,000?
Right.
So
Not necessarily,
well,
not
there'll
necessarily.
be terms to pay it off, but
There'll
there'll
be
be no
terms
more
to pay it
loan.
off, and typically they're in terms of 3 to 6 years, or if longer, 5 years. But
And no more
the goal
balance to
is,
take.
the goal is to keep the line of credit available, so as we need it, we can use it and pay it back.
Got it.
The
Any more
rates have
questions?
gone up too. Rates have gone up.
Oh,
They all have, well, you know
Yeah.
better, right,
Yeah.
Maggie, working in your environment?
okay, any other questions about it?
Ready to go.
Did you-
Yeah, I was just waiting for that
Okay.
resolution.
Is there a motion on the floor to adopt resolution 2023-01?
I'll make a motion.
Okay, Ann makes the motion.
I second.
Okay, Maggie seconds. Roll call vote?
Greg,
Yes.
Maggie,
Yes.
Rosemary,
Yes.
and Max.
Yes.
Okay,
Thank you.
thank you, Brent.
Thank you, Brent.
Foundation report.
Okay, well, I'm gonna echo some of what Jamie had to say. Joanne's still here, so I want to thank her and her sister for their generous donations towards our upcoming quilt raffle. They've donated the quilt, Diane and Joanne. And Joanne is a beautiful photographer, and she's also donating a picture. And the letters will be going out next week. And the foundation also paid the district $25,500 for a past expense. And let me see what else.
26,500.
That's it, no, my number's kind of sloppy here. Yeah, 26,500. So that was taken care of then. And our letter this year is going out to pay for beds and mattresses for some beds and mattresses for the patients that we have here at the center.
You know, when Steve Pritt was here, he said one of the best things to do was to always change the beds and mattresses.
Yeah.
And I'll never forget that's what he said. He goes, that's what,
Good song.
he said, yeah, that's nice. Well, thank you to the foundation.
Yeah. Okay. Did I forget anything on that?
No, I think that was it, no.
Okay. And thank Jamie for doing all the work with the letter and getting the letters out.
Did the foundation do the part of the museum, or was that just the staff?
I think it was just staff.
The staff?
Yeah.
It was very nice.
Yeah. Oh, and I wanted to ask Ida too, Max was so worried about the people who work here not being able to go because it was from 3:30 to 6. So Ida generously had the people staying longer, so they stayed till 8. So I was wondering how many of the staff were able to come?
Yeah, only 4 showed up, and they only showed up temporarily because they were heading to a sales meeting for one of the pharmaceutical companies. So they came in very shortly. Yeah, so I think we exited maybe about 7:30 that evening, so, yeah. It wasn't a presence, and what I find a lot of the times is, you know, our staff want to get home to their families. They've been working all day, they're tired, and unless they're getting paid to participate and be there, they just don't, they you know, they rather go. So it's understandable, but yeah, there wasn't much of a presence, so.
Well, thank you for accommodating Max and the staff.
Of course, of
Well,
course.
I think it goes to the historical society, because usually the guys are the ones that stayed over.
Yeah, everybody did stay late just to accommodate. And we brought in dinner for everyone because we knew it was dinner time, so we made sure we had dinner. And, you know, went through that. But yeah, there was only 4 team members that came.
Any questions of Rosemary? Okay.
Anyway, it was very well done. The event was very well done and very well attended by the regular people.
Yeah.
Yeah, there was a lot of community members.
Yes, a lot of community people. Past community people and present community people. Yeah.
It's too bad with COVID that we couldn't have had it here, you know?
So there-
It's just changed the whole dynamics of where things can be.
So there is a future plan for the garden. So we'll
Oh,
have
really?
in the summertime,
In
yes.
the garden?
Yep, it's gonna be called Stars, Underneath the Stars, and it'll be maybe in September is what we're planning.
Better weather.
Yeah,
Good.
and see, hopefully we can capture some more people to join us.
So
So,
the garden will be in full bloom then.
yes,
Yeah.
it'd be beautiful.
Good, good.
Okay, District CEO report.
So on that note, Sophie, we're gonna turn on the TV to show you guys the event.
Oh.
Yes, we put a little video together of the event.
Is it a museum?
A little bit of music, yeah.
Oh, okay.
There we go, Sophie, tell us.
Big kids in the way?
No, you're fine. Just give Sophie a minute while she tees it up. It was on earlier, this turns off.
Do the residents have all the good stuff on their TVs?
Yes. And when we don't have it, they complain, let me tell you. The sports, especially during sports season, and, oh, there it goes.
Yeah, the invitation was very nice.
There's Jeff.
Oh, that's cute.
Board members.
And many of the community
Gorgeous.
received, Ida's committee took the time to make certificates for a lot of these people. Yeah, Jeff, the past pharmacist,
Yeah.
Sylvia.
and the past pharmacist.
Miss
Pauline.
Pauline.
There's Jack.
Our supervisor.
Oh, okay. What was it?
The Hamleys,
The Hamley family, yeah.
Gloria.
And the police who have been supporting this so well.
Our PA, our mayor.
Oh, that's
There's, she was in charge of, her mother was in charge
Of the garden.
Oh, was she?
There's a proclamation we got from
Yeah.
Senator Ana Caballero's office. Superintendent of
the
schools,
Hamleys, yeah.
staff.
Staff, yeah. That's it.
And that's it.
That's very
Just a little short one. Just to
Thank you,
share
that was
with
very
everybody.
nice.
So
Very
that's where I
nice.
wanted to start my report. So thank you all who attended, who were able to join us. It was such a beautiful event. I shared earlier at the foundation. It was like a reunion of history, and our goal was to celebrate the past, the present, and the future. And really, it was all those that became before us. Board members, community members, and staff that made the district what it is today. Thank you to all who joined. It was such a beautiful event, and there will be an additional event, like I mentioned, celebrating our 75 years. We still have today a presentation with Rotary and showing them all the history stuff. And somebody had mentioned at the Rotary meeting that they didn't realize what all we did here at the district, which is important to share and kind of keep telling that story. So thank you to everyone who joined. We celebrated Valentine's Day, and I hope everybody had a nice Valentine's. We had a barbecue lunch for all of our staff to celebrate that day. Very nice, well attended. We raffled off a huge basket full of goodies. The staff contributed, participated, we all gave a little bit of something, and they gave the donation so that the staff can have a basket full of goodies for Valentine's. Just to update you guys a little bit on Oshbod, as you guys recall, that's the power outage project. We got final approval, but we are waiting for reimbursement from our insurance on that loss. That will probably be in the tune, last count, about $140,000 once we get those monies. So we'll be working with the insurance, and probably going to take 45 days or longer to get that. But that will finally close out that project, which took over a year and a half to complete that. We talked earlier, Eden Valley, unfortunately, is experiencing COVID in the building. And I'm seeing it even at the clinic. We're seeing some patients coming in with it now. I don't know what's happening, but it's kind of like rearing its ugly head again. The good thing is that the levels are not what they used to be. So we have 3 patients here and 5 staff. So what we've done is that we've implemented testing response 2 times per week. Trying to get that not to spread any further than it is right now. Census, we've talked about that earlier. Census remains at about 50 right now. 51 with 19 Medicare, 4 managed care. We have some private and 24 Medi-Cal. And we've admitted in referrals. We've admitted from Salinas Valley Memorial, Natividad, and Chomp were our admissions for the month, and I'll tell you exactly, give me a second. So 14 from Salinas Valley Memorial, 1 from Natividad, 1 from UCSF have been admitted. So in the month of February so far, there's been 16 admits.
How many?
16. And keep in mind, people, as they get well, they come and they go. So, those are mainly the short terms.
So what's the census today?
51.
51.
That's wonderful.
Yeah,
And they
51.
still have the physical therapy, therapist is working, doing all that?
Yeah. Mhm.
Do we break that at all, what the long term is and what the rehab, the 4 to 6 weeks or so?
Yeah, so your long-term 24. That's your Medi-Cal. Your Medi-Cal are usually your long-term, your long-term folks.
Okay.
Yeah. And so you heard Brent today explain that. What you typically want to do is have, in order to break even, and I think that number I have to relook at that with Brent, it was about 15 Medicare. I think with the costs now and the inflationary costs, that's gone up substantially. And so in the past, it used to be about 15, but I think that number is a lot higher than what it used to be. It just costs a whole lot more.
So all the rehab are private insurance, you're saying?
They're not, no. Rehabilitation comes in a mix of regular insurance, private pay, or Medicare. So it's a little different. It's a little different. And so that's where we're at with census here at Eden Valley. So I did want to, before I move on to Eden Valley report, we did include, once again, the letters that were given in comments from the Romali family, along with the Cordial family. And so I had the nurse administrator give me an update. So the two main key in that particular document were communication and visitations. And this is a mitigation plan written by the administrator, Natasha. Nurses will be re-educated regarding informing the residents responsible party when there's changes of condition of any kind. Nurses will be re-educated on a timely responses to messages. Administrator will check in with family and members on a routine basis. So that was the communication piece of those letters. The second half of those letters was the visitation policy. Since that time, visitation has changed dramatically than what it was before. In the past, you had to schedule an appointment and those kind of things. That's changed now. This facility will follow CMS guidelines regarding visitation, which state that the resident's family will not be subject to visiting hours, limitations, or other restrictions not imposed by the resident. In-room visits will be allowed unless visit infringes upon the safety, privacy, and rights of the other residents. Because as you know, the rooms are shared. So if another resident has, then you have to be respectful of that. All staff will be educated and updated upon visitation policy. And then letters were sent out to the families on February 3rd with the updated visitation guidelines.
I want to ask you, are we going to be able to meet Natasha today?
She is not feeling well, so she's not here today. Yeah. So that was a going plan, but you will see her next month.
So is that the official policy, or that's notes about the policy, or do we have a written official visitation policy?
There's a written one, yes, and that's been passed along to the residents, and it's included in every package when a new resident comes to the facility. It's included in their admission package.
So we have a written district policy.
That is a written operational policy for Eden Valley. So they're their own
It's still approved by the district, by the board, so it's a policy that.
It is not. It's approved through Eden Valley. It's their policy written based on the CMS guidelines. So that's an operational policy, is what that is.
And the letter was mailed to all the residents'
Yes.
families, so they're aware of the
Yes.
policies.
So I wanted to make sure that I updated you guys on that as well. What else? At the clinic, you guys heard a little bit. We're still trying to improve upon the the visit counts. Visit counts are still low year over year. And as you heard from Brad, the revenues are down because those visit counts continuously be down. So we're rescheduling or revamping our scheduling system, which will allow for there to be a better flow of people as they're coming in. And you heard it earlier in the comments, you know, people want to come in and get their appointments. The reality is that when you go to another center and you want to get an appointment, it takes 3 months just to get in.
Oh, yeah. It does.
It's not overnight. And remember, at the clinic, we're the only place in the community that provides Medi-Cal services. Medi-Cal, for example, Pinnacle doesn't do Medi-Cal.
Well, they don't.
No, they made that choice. Clínica de Salud does it, but Clínica de Salud only has 2 doctors. So when you look at our entire community, as big as it is, we're the only place in town. And CCAH, I had a conversation with them. You know, they have over 8,000 patients assigned to us. Think about that. So our patient count it was roughly about 40,000 at the end of the year. So we're roughly seeing about 200 patients a day. So what we have done is that we're trying to improve upon the schedule so that providers can see those 24 plus patients. That's important. And 2, so that the appointments, like what was mentioned earlier, as they're coming in and there's an appointment and there's a slot, it can be filled rather than having to wait. Because our morning lines, although we have improved upon, they still remain long, and they can remain up to 30 or 40 deep. Yeah, they can. So we've done that. The phone system, so what we're doing is the last clinic manager put in some phone automations that are just not working. So I'm working with the new clinic manager, and if I haven't mentioned, Elisa De La Torre joined our team. She comes with a vast amount of experience. She has a bachelor's and a master's degree in healthcare, and she actually worked at Stanford in their clinics and is now working here at our clinic. So she's helping us revamp the scheduling as far as the phone system as well. So what we're finding right now is we're just going to go back to the old school way of answering the phones, and when they call, rather than going through the call tree and doing all these other things, so that complaints that come in, oh, you don't answer our calls, that's what it is. Because people, what it is right now, people call in and they have to put in their date of birth and leave a message. When you're a Spanish speaker, it's tough because you don't understand all those prompters, and it takes a long time. So we're thinking that the best solution would be to eliminate that. So we're working on those scenarios at this moment, and with our phone system to try to improve upon that. That will improve. That will improve the phone system as well. So we just added Alicia. So please, if you're at the clinic, please help me in welcoming her to our team. As well, I mentioned earlier, Celia in our business office has found another position, and she's moving on. She wants to continue expanding her her education, so she wants to go back to school and maybe become a CPA. So good for her. You know, she's a loss for us, but a good thing for her. So we will be, we've hired a business office manager who has many years of experience, as a bachelor's degree in business administration. She will come help manage the business office, which includes our billing department for the clinic. Will oversee the business revenue flow for Eden Valley as well. So she'll be doing that. She's already on staff. She's given her 2-week notice, but she's coming in on staff to get trained before Celia leaves. So just an update on that as well.
We will really miss Celia, because she's been around a long time, and she did a good job.
I'm really going to miss her as well. Clinic care management, I shared this program with you guys last month. This is to help grow our patient interaction with our 65-year-old and older. And Craig's smiling because he's probably gotten that text message. And that's a billable occurrence. We have billed, I think, like typically was on a $30 average. The maximum that we can get from the billable occurrence is about $80. So that's going to improve upon our billable occurrences, but it also comes with education. It comes with a nurse who interacts with the patient. But there's a bill that was that's being produced by one of the assemblies, the process. So we're really working with, and that's where the new scheduling is important as well, because we want to give providers that time to complete their encounters. We close our books by the 5th day.
Do what?
We close the books every 5th of the month, because otherwise Brent could not provide you this report. And we have 3 people in there, which is a coder and 2 billers. And then we have the accounts payable person, and then the business office manager. That's what makes up the whole team.
So when they bill for a visit, how long does it take on the average to get reimbursed or to get paid for that visit?
So we make per visit we make $80, and every patient has 1.7 visits on average, claims per visit on average. So we make about $150 per visit.
But my question is that if they were seen today, billed today, how long does it take before the insurance companies and all of them pay you for today's visit?
It can be up to 90 days sometimes.
90 days?
Yeah. It's ridiculous, and some days it's longer because they have other concerns and issues. And so that's what we're
Why
having.
does it take so long?
There's so many requirements and changing requirements that they have, and they're behind.
Who's they?
The insurance companies, and they're slow in their delivery, and we're kind of at the mercy. Yeah.
Could we, maybe next time have a report, because we're trying to get our number of average visits per provider up, how that's going.
And what about bad debt? Is there any bad debt?
There is. What we do is that we work with the local collection agency to try to help us. We try not to send them that way. We really want to help our community. So we really work really diligently.
But even with the insurance company, I mean, if they're not paying on time, you know, I'm not saying they're a bad debt, but at the same time, is there any recourse to tell them to speed things up?
I wish, but yeah, not really. You could submit all the paperwork, they have it complete.
Well, and you know, the reason I bring this up is that the previous CEO, he was working with, you know, trying to recoup some of that bad debt and some of those things that you know, we're going through there, so.
So we do the same, and we work with our collection agency to do that, and we work with our billers and collectors here, and they're very good at that. They try to stay on top of that. Yeah.
Any other questions of Ida? Yes.
So talking about our billing count, or our patient count, because we get this nice report every month, but there's, one of the things is, how do you compare Dr. Jackson to Dr. Nguyen or whatever? Some of these people work 5 days a week, some of them work 3 days a week, some work 8-hour shifts, some work 10-hour shifts. So when you say 24 patients a day, unless you're working on an average, a 10-hour day shift person hopefully sees more than that 8-hour day shift person. So these numbers don't, I'm not sure what this patient count really tells us other than you got a bunch of numbers. At the bottom when it says you have 4,694 visits that month, what does that tell us, considering that the mammography visits and the NST visits and the care management and the Dr. Pena visits are not a comparable visit in time?
So what was your question? What are you?
I'm not sure what this report's telling us, because without breaking down the difference between which providers are employees, which ones are contractors, which ones are here 3 days a week. Well,
that wouldn't make a difference to your question.
Then this report's a waste of time, I think, because it doesn't tell us.
Okay, I don't need to include that.
But
What would you like to see?
One, I'm trying to figure out what you're trying to tell us with it.
It's just telling you on a monthly basis how many visits they actually did. And these are actual visits.
So I think I get something out of this in that, for a simple one, is when you look at mammography in January of '22, we had 25, and now today we're seeing 57 in the month. So at least that shows an increase. But
I
because
mean-
that's when the women's center just opened. And then, you know, it also, for example, you know, it helps with the lab work. You see that there was 236 in January, and I think it's more as
So
comparing
these
them
are
apples to apples.
It's
rather than-
cumulative, but I think what Craig was asking is if we can see how that compares to the 24 patient count. I can certainly add those averages in there. So it's a cumulative.
But it's really hard to break it down too. I mean, as Max is saying, the provider worked 4 hours, 3 hours, 3 days a week. I mean, it's.
Yeah, I know, so no, we don't have,
Yeah, you can't break it down that way,
there's
I mean.
only, so there isn't any that work, yeah, mainly they
But
all work.
it's, like Ann, I mean, it's very informational.
And the ultrasounds are up.
I like seeing it.
So, yeah,
Because
so
it tells me something.
Yeah, so continue with it.
So which of our providers are doing 24-day, which ones aren't?
Well, that's what.
That's what I'm asking.
That's what he's asking.
That we provide.
Yeah.
Is that what you're asking?
That's part of it, just because I'm saying this analysis doesn't answer things other than it says we had 5,000 people come to our clinic.
Okay.
But when you're
We
comparing
can
that,
break it down by average.
or,
That would be a good point. So that way you can see by provider who's actually meeting the mark.
and then that way.
And what's expected if they're only there 6 hours or whatever, what's expected as opposed to someone there 10 hours, you know, those are, I think.
Right, yeah, you say 24 a day, but well, is that for everybody or for a
But it
6-hour
has to be
person, 10 hour?
adjusted,
Yes,
yes.
to make it equivalent value by just a value, a word.
That's what I
So
was
a
asking for.
10-hour day employee, just so that you know, cuts off at the same time as your regular employees. So there's no difference
Yeah.
outside of that.
Okay.
So they don't have more hours to do
Do it.
service. Yeah. Okay? And I think that was all it for my reports.
Any other questions?
All right.
Okay, if not, we'll adjourn the meeting and we'll meet next Thursday,
When?
March 30th. March 30th.
Is that gonna be also with the strategic planning day, or is that a different day?
That'll be a different day.
Different day.
Yeah. Just to make it easier.
Are the meetings the last Thursday of the month or the fourth Thursday?
Fourth Thursday.
The fourth.
But during the holidays.
Last of the
No,
month,
because
the last
last month-
Thursday of the month.
Next month, I think it's the 5th.
Yeah, it depends on the month. There's some months that are,
They
they
have
have an
the
extra
That's
week.
the last
Yeah.
Thursday.
And then we change it with the last Thursday, sorry. And then we change it with the holiday season as well, when there's holidays and stuff.
Like November,
So
we meet a week earlier.
Yeah,
Yeah.
Thanksgiving.
Okay?
Okay? Thank you, everyone. Have a great rest of your evening.